we often put a lot of trust, in medical organizations. We expect them to be based on solid science, strong ethics.
Absolutely. That's the foundation we rely on.
But what happens when, well, the leading voice in a specific area of healthcare suddenly faces this huge wave of scrutiny?
Yeah, that's a big question.
Today, we're diving deep into a really significant discussion. It's centered around the World Professional Association for Transgender Health, WPATH.
Right, WPATH.
And surprisingly, this group, often seen as the authority, in transgender healthcare, is now right in the middle of a pretty intense debate after some internal communications came out.
Exactly. And this isn't just some minor disagreement, is it? It feels like something that could genuinely reshape how we understand and approach transgender healthcare.
Totally. So in this deep dive, we're going to try and take apart this controversy around what people are calling the WPATH files.
We need to look at what these internal messages reportedly show, and crucially, consider the very different ways people are interpreting what they mean.
Okay, let's unpack this then. For today, our sources include a report that's analyzed these leaked files.
The one causing all the buzz.
Yeah, that one. Plus some pretty critical articles responding to it. And to get the full picture, we've got info straight from WPATH 2, their website, Wikipedia.
Good. Balanced perspective is key here.
Our goal, really, is to get past the noise, understand the core of this debate, what's actually going on, and maybe more importantly, what could this mean for transgender healthcare going forward?
So, first things first, maybe, what are these WPATH files everyone's talking about?
Okay, so fundamentally, they're internal communications, leaked from inside WPATH.
Like emails, forum posts?
Yeah, stuff like messages from their online forum, and apparently even a recording of a panel discussion between WPATH members.
Okay.
Now, the report that really kicked things off, it takes these files and makes some pretty serious claims.
Such as?
It argues that WPATH's approach to transgender healthcare isn't really based on solid science or even strong ethical principles. That's the core accusation.
Wow, okay. And the report goes further, right? It suggests WPA promotes what it calls arbitrary medical practices.
Exactly, including hormones and surgeries. And the report seems particularly worried about this for minors and what it calls vulnerable adults.
And the argument is that this is driven more by, like, patient demand or activism than actual hard science.
That's the claim, yeah. That it's consumer demand and activism, not necessarily robust evidence, pushing things forward.
Okay, this is where it gets really interesting then. Based on these WPATH files, what specific concerns does the report actually raise?
Well, let's start with informed consent. That's a big one.
Always is in medicine.
Right. The report claims that even within WPATH, members were acknowledging how difficult, maybe even impossible sometimes, it is to get truly informed consent, especially from teenagers.
Why? What was the reasoning given?
It seems to be about a limited understanding of the long-term effects, of hormones and surgeries, and maybe even just a basic grasp of biology.
That's a significant concern. Are there examples given?
Yeah, the report gives some specific examples that are quite, striking, like young patients wanting certain effects from hormones.
Like a deeper voice.
Exactly. But maybe not fully getting that. It often comes with other changes, like, say, facial hair. It highlights a potential gap between what a patient hopes for and the biological reality.
Yeah, that really brings up the question of how well someone, especially an adolescent, can grasp the full scope of these medical interventions.
Right. And it's not just physical changes. The report also mentions discussions inside WPATH about fertility preservation.
Another complex one.
Apparently, some members said trying to talk about this with teenagers was like talking to a blank wall. There's even an anecdote about kids having really simplistic ideas about adoption, like it's just an easy backup plan.
Which, as we know, it often isn't.
Exactly. So the report suggests this points to maybe a lack of real understanding about how treatments could irreversibly affect their future fertility.
And does this concern about consent extend to surgeries, too?
It seems so. The report mentions a WPATH panelist agreeing that patients are often so scared before surgery
Understandable.
that they just don't absorb the crucial details about the procedure itself. Which, again, raises that question. Can you really give informed consent if you're that afraid or stressed?
A valid point to consider. What else does the report focus on?
Well, it moves on to the argument that these medical interventions, the ones that change sex traits, especially in minors, are essentially experiments that escaped the lab.
Meaning?
Meaning the claim is there isn't enough solid long-term scientific evidence to really back them up yet.
Okay, and this ties into an idea the report mentions, runaway diffusion. What's that?
Yeah, it's basically when a new medical practice, one that isn't fully proven yet, gets adopted really widely.
Kind of catches on.
Right, catches on before we completely understand its long-term effects. It
Sure.
highlights why we need to keep critically looking at medical innovations, you know?
Sure. So what evidence does the report offer for this experimental claim regarding WPATH practices?
It points to a few things. One is supposedly a comment from a WPATH member saying that the fertility question has no research.
No research. That sounds pretty definitive if true.
That's what's reported. And there's also a suggestion that maybe letting some puberty happen before using blockers might be preferable.
Which the report interprets as, what? Improvising.
Yeah, basically that it suggests they're kind of figuring things out as they go rather than following established evidence-based protocols.
Okay. Is there external evidence mentioned?
Yes, the report brings up a 2020 review from the Cochrane Library.
Ah, Cochrane. They're usually pretty rigorous.
Very. And this review apparently found that the quality of research on cross-sex hormones for natal males was so low that not a single study actually met their criteria for inclusion.
Not one. That's surprising.
It is. And the report also notes that even in WPATH's own latest standards of care, the SOC-8.
The 2022 version.
Right. It apparently uses phrases like studies are needed for certain practices, which, the report argues, implies these things are still under investigation, still kind of experimental.
So, lack of long-term data. Questions about existing research quality, and even WPATH's own documents suggesting more research is needed.
Yeah.
That seems to be the core of that argument.
Pretty much. Then the report shifts to surgical complications and, again, whether patients are properly informed about the risks.
Okay. What examples do they give here?
They mention a really concerning one from an early Dutch study. Apparently, there was a nearly 2% fatality rate linked to a complex surgical technique.
2% fatality. That's incredibly high for elective surgery.
Yes, and the report specifies this was in individuals who hadn't gone through full puberty. It uses this to argue about the dangers when surgery happens without typical biological development.
And suggests that in other medical fields, a rate like that would halt everything, right? Trigger a major investigation.
That's the implication, yes. The report also talks about painful erections for natal males taking estradiol.
How is it described?
In pretty stark terms, like broken glass. And the report alleges WPATH endorses this treatment for adolescents without ensuring they fully grasp these, well, potentially quite debilitating effects on sexual function.
That sounds incredibly painful.
Yeah,
And difficult to consent to if you don't fully understand it.
exactly. The report also digs into the complexities after vaginoplasty, like the lifelong commitment to dilation needed to keep the neovagina functional,
Right. That's a major post-op requirement.
and the risk of neovaginal stenosis narrowing. The point being, these are really significant long-term things patients need to know about upfront when considering irreversible surgery.
Absolutely. It seems there were internal disagreements mentioned, too.
Yeah, interestingly, the files apparently showed debates within WPATH, for instance, over things like BMI restrictions for surgery.
BMI restrictions. Why the debate?
Well, some members reportedly argued against them, even calling them potentially systemic fat phobia. So it shows there isn't necessarily internal consensus, even on seemingly straightforward medical criteria.
Okay, so beyond surgical issues, what about mental health? Did the files touch on that?
Yes, that's another major section in the report. It raises concerns about discussions found in the files about starting hormone therapy for people with serious mental health conditions.
Like what kind of conditions?
PTSD, major depression, dissociative disorders, serious stuff.
And the concern is?
Well, the report points to a WPATH member who apparently questioned whether people with these kinds of challenges can actually give truly informed consent.
A fundamental question.
And they also asked, should a pre-existing psychiatric illness automatically block someone from starting hormones?
So, grappling with complex comorbidities. What did the discussions conclude, according to the report?
Well, it gives examples of WPATH members sharing anecdotes, saying patients with things like DGD, depression, bipolar, schizophrenia were doing just fine on HRT or after surgery like an orchiectomy.
Just fine.
But the report stresses there's often a lack of long-term follow-up data cited in these anecdotes to really back that up.
Right. Short-term observations versus long-term outcomes.
Exactly. And there's one specific example cited that's quite jarring. A surgeon reporting on doing vulvovaginoplasty and mastectomies on patients diagnosed with dissociative identity disorder, with follow-up reported as only 6 months.
6 months for irreversible surgery on someone with DID. The report questions if that's long enough to assess outcomes properly.
Precisely. It questions the appropriateness given the complexity of the mental health profile and the short follow-up.
Wow. Okay. What else? Any other types of procedures discussed?
The report mentions what it calls non-standard surgeries. It suggests WPATH has considered things like nullification, aiming for a neutral appearance, and even bigenital surgeries.
Bigenital.
Yeah. And also castration for individuals identifying as eunuchs.
And the report's concern here is the ethical side.
Yes. It highlights what it sees as a lack of deep ethical consideration within those discussions about removing healthy reproductive organs for these non-traditional reasons. It emphasizes the gravity of irreversible procedures when not driven by typical medical necessity.
Right. A very different context than, say, cancer treatment.
Exactly. And finally, the report draws some pretty heavy comparisons.
Like what?
Like historical medical controversies, lobotomy, the drug DES.
Diethylstilbestrol, yeah.
Yep.
Caused issues down the line.
Right. The point seems to be a warning about potential unforeseen long-term harms when medical trends maybe outpace the evidence. And it hints at the danger of, perhaps, groupthink, or not giving enough weight to dissenting views within medicine.
So basically arguing for extreme caution and highlighting potential parallels with past medical missteps.
That seems to be the message from that part of the report.
Okay, that's a lot to take in from the report's perspective. But it's really crucial now to look at the other side, right? The counter-arguments, the context.
Absolutely essential. We need the full picture. So one strong counter perspective comes from a publication called Trans Rights.
And what's their take?
They argue pretty forcefully that this WPATH files report is basically like the Twitter files.
Meaning an attempt to spin a narrative.
Yeah. They see it as an effort by anti-trans activists to spread misinformation and discredit healthcare that many trans people rely on. Their view is it's not a genuine inquiry, but more like an attack with an agenda.
Okay. And do they challenge the interpretation of the files themselves?
Yes. They point out that some journalists who are transgender and have actually read the leaked files claim the report's narrative is, quote, easy to debunk, suggesting the communications were maybe taken out of context or selectively used.
So a direct challenge to the report's interpretation and motives. What about WPATH's own position and structure?
Well, it's important to understand what WPATH actually does. They develop and publish their standards of care, the SOC.
Right, the guidelines we mentioned.
These are meant to guide clinicians working with transgender and gender nonconforming people. They're pretty influential.
And they update them, right? You mentioned SOC 8.
Exactly. They aren't static. WPATH states the SOC is updated based on evolving scientific evidence. Version 8 came out in 2022, and they describe it as using a more rigorous and methodological evidence-based approach than previous ones.
Suggesting they are trying to follow the science as it develops.
That's their stated position, yes. An ongoing effort to refine guidance.
And who makes up WPATH? Is it just doctors?
No, it's multidisciplinary. Members include doctors, psychologists, lawyers, social workers, researchers, a mix of professionals.
Right.
Interestingly, non-professionals can join too, though they don't get voting rights. And funding comes from membership fees, donations, and non-commercial grants.
And didn't they make a statement about depathologization a while back?
They did, yeah, back in 2010. It was a statement basically shifting away from viewing being transgender as inherently a mental illness. It shows their understanding has evolved over time.
Okay, so context is important. What about the actual content of the forum discussions? Does the other side offer a different view of those?
Well, the argument is that the report focuses heavily on potentially controversial snippets. But these sources suggest the full discussions within WPATH forums likely cover a much broader range of topics. Things like the inherent complexities of informed consent, acknowledging it's difficult. Also, the importance of multidisciplinary care teams, managing patient expectations realistically, and the huge impact of societal pressure on transition and sometimes detransition.
So suggesting the internal conversations are more nuanced and self-aware than the report might imply.
Exactly. That it's probably not just one-sided discussions, but people grappling with difficult clinical realities, ethical dilemmas, evolving science, the whole complex picture. Focusing only on certain excerpts might miss that broader context.
Makes sense. Are there other examples of these more nuanced discussions?
Yes, apparently there are discussions about tailoring hormone doses to individual patient goals, not just a one-size-fits-all approach.
More personalized medicine.
Right. And emphasizing the need to separate someone's gender identity from the specific medical decisions they make. suggesting a more careful, individualized approach.
What about patients with those co-occurring conditions, the mental health issues?
The counter-narrative suggests that yes, those are discussed, but often with an emphasis on needing a slower, more cautious approach in those cases, recognizing the complexity.
So not dismissing the concerns, but framing the approach as more careful.
That seems to be the point. And interestingly, these sources say the WPATH forums also contain discussions actively debunking the autogynephilia theory.
Ah, that controversial theory.
Yeah, describing it as outdated and stigmatizing, and instead emphasizing the diversity of gender identities and experiences. So pushing back against some older, more problematic frameworks.
Okay. Anything else from the files highlighted by these other perspectives?
Just that they also apparently touch on sensitive topics like how hormones affect libido and sexual function. Members share personal experiences, offer suggestions for supporting patients, again, suggesting an internal effort to address the real-world complexities of care.
Right. So it paints a picture of ongoing, complex, professional discussion, rather than just the potentially alarming snippets highlighted in the critical report.
That's the counter perspective, yes.
So wrapping this up, as you can clearly hear, this deep dive into the WPATH files really lays bare a significant tension, doesn't it?
It really does. On one side, you have these leaked communications igniting a pretty serious debate about the scientific foundations of transgender healthcare, especially for young people.
With some very serious allegations in that report about care standards maybe being driven more by activism than solid evidence.
But then, on the other side, you have these strong voices emphasizing just how vital access to care is for transgender individuals.
Right, and questioning the motives behind the leak and the way the files have been interpreted. Arguing that the report actually misrepresents WPATH's efforts and could undermine necessary medical treatment.
It's obviously incredibly complex to navigate this. You really have to consider all these different viewpoints carefully.
And recognize this is a field that's changing fast,
Hmm.
With really passionate people on all sides, there are definitely no easy answers here.
No simple takeaways at all. Which kind of leads to a final thought for you, listening. When we see situations like this where medical understandings are clearly evolving and there's disagreement even within the medical community.
Like with transgender healthcare right now.
Exactly. What responsibility do we have, just as informed people, to try and ensure practices are, ethical, based on good evidence?
And what other questions does this whole situation raise for you about how medicine reaches consensus? Or that really tricky balance between respecting a person's autonomy, their choices, and providing responsible professional guidance?
Lots to think about there. Definitely food for thought.